G'day, my name's Sam and I'm a third year nursing student at Australian Catholic University, and this is my video application for the 2026 new grad program. Um, in response to the key selection criteria, question one, in my role as an AIN at North Canberra Hospital, well-developed communication and interpersonal skills are an essential part of the job when dealing with consumers who are confused or agitated. One example of this is when I have supported an elderly confused patient with ADLs in their personal cares. By using simple language, non-verbal cues, and a calm tone to help build trust and rapport, I was able to assist the patient with all of their cares without any problems. Um, Communication with the team is also an essential part of the job, alerting the nursing staff to any changes in behaviour of the patient so they're able to respond appropriately to those changes in a timely manner. Um, if I ever make a medication error, the first thing I would do is to report it to my team leader or other nurse in charge, such as a CDN, CNC, and I would monitor the patient for adverse reactions to the medication. Um, I would also want to check to see if there's any contraindications of the medication for the patient through comorbidities or other medications they may take. Um, I'll follow policy and procedure in regards to escalation protocols, such as calling a MET if it's necessary, and I'd ensure timely and accurate documentation into DHR as well as riskman. Um, to keep my patients safe when administering medications, I follow the 10 rights of medication administration and also try and minimize distractions during uh, dispensing and administration. Checking the patient's details through their wristband and having them repeat it while checking through DHR, checking allergies, and also understanding what each medication is that I'm administering. Um, if I ever feel overwhelmed due to a patient's high acuity, um, my first task would be to prioritize urgent and time sensitive tasks using clinical reasoning. Um, Engaging in a structured handover and shift planning can assist with those task prioritizations. And seeking support from senior nurses and other senior team members can also help in task prioritization or help in the tasks that I might not have a lot of experience in managing yet. Um, Teamwork is also another big strategy that could be used. If there's AINs available, delegating tasks to them to help relieve some of the pressure of that high acuity patient load, such as their personal cares, their hygiene, and can also relieve some of that burden. um, my practice, my clinical practice is guided through the NSQHS standards. Some of the ways I've adhered to the standards include Standard 1, clinical governance. I follow all relevant policy and procedure, and I escalate concerns in a timely manner to help with risk and incident management. Standard 3, infection control. I maintain good practice with hand hygiene, standard and transmission based precautions. I maintain a safe and clean working environment through the removal of rubbish, dirty linen, urine bottles, etc. I ensure cleaning of mobility aids and shower seats before and after each use. Standard 6, communicating for safety. I use ISPA handovers at the patient's bedside, and I involve them in the process to ensure clear communication and partnering with the consumer. I document all of my notes in a timely, efficient manner, including any wristbands that need to be completed. For work health and safety, I also ensure I report any faulty equipment or other risks and hazards to ensure a safe working environment for patients and colleagues. I also follow all manual handling protocols and have completed CHS manual handling training as well as all other relevant CHS training. Um, and finally, a contribution that I've made for a positive patient experience. Uh, Recently, I was working with a confused patient who would become easily agitated as they struggled to communicate their needs to staff. Through my shift, I took my time to sit with the patient and work with them to figure out what their needs were, Through showing kindness and respect towards this patient, I was able to develop a rapport with them and assist them with their personal cares and their comforts that they otherwise would have struggled or even just given up trying to communicate and become frustrated. Um, I was then able to hand over to future staff how to help communicate with the patient using those non-verbal techniques, and also just taking some time and patience with the consumer. Um, this example shows my commitment to providing positive patient experiences through the CHS values. Thank you for listening to my application. Bye.